All right, so we all know that a lot of chronic illness can be caused by mold exposure and compromised detoxification, and maybe genetic mutations that affect your ability to detoxify certain things, certain exposures that you might have. So what exactly goes into detoxification? This is part one of a series, and I'm going to attempt to kind of run through the way your body detoxifies things, specifically through your liver, and why this can break down and cause a lot of chronic illness. This gets a little bit complicated. So in general, there are three phases of detoxification: phase 1, phase 2, and phase 3. A breakdown in any part of these detoxification pathways can cause extra symptoms. A lot of what your body gets exposed to, things like excess hormones, plastics, mold, heavy metals, other types of exposures that you might encounter in the environment, or you're eating, or your body is producing and you need to get rid of the excess of, that will go through phase 1 detoxification. Phase 1 detoxification is your liver enzymes. A lot of the liver, so like medications play a huge role in this too. Liver enzymes are those CYP enzymes that we hear about a lot. Liver enzymes are the reason why you can't or you shouldn't eat grapefruit with certain types of medications. They're the reason why you shouldn't drink with certain types of medications. This is phase 1 detoxification. Very many times produces an intermediary that is more toxic than the original thing. And this is the reason why some people metabolize, like, say, coffee really fast, or some people are really not great for, like, not really great at alcohol. So like a very stereotypical thing is like Asians can't drink alcohol, right? Because we have enzymes that have really fast phase 1 metabolism, but maybe not as fast phase 2 metabolism. So the alcohol hits our bodies, we run through the phase 1 really quickly and actually end up with a lot of intermediaries from the alcohol that are more toxic than the alcohol. So we feel those effects really strongly, really fast. So now think about this happening in a patient who has mold exposure, right? So mold is very commonly metabolized through these CYP enzymes, and they can clog up the enzymes because your body really wants to get rid of them. So you can run through phase 1 really fast with mold and then end up with a lot of toxic intermediaries that are, really gunk up your phase 2 enzymes too. And this can be exacerbated if you are already on medications that need these enzymes to be processed through your liver as well. And the kicker with this is that a lot of mold toxins can actually induce phase 1, which makes those enzymes work a little faster because your body does want to get rid of those mold toxins, right? And that actually pushes out more toxic intermediaries that are floating around your body even faster than it can be resolved by the phase 2 detoxification process. And this is one of the reasons why a lot of people who have exposure to mold will start feeling like really wired, inflamed, and like their immune systems will start going a little bit crazy because you have more toxic intermediaries just floating around in your system. And this is also what makes detoxification so complicated with people who have mold exposure or other chemical sensitivities that they have an overload over, whether that be like pesticides or herbicides or whatnot. Because you can't just give like a detox protocol for them. It will not work if you don't understand where they're at in terms of like what phase of detoxification is the bottleneck here. Because one very, very common detoxification supplement is something like DIM, right? But the thing about DIM is that it pushes the CYP enzyme. So it induces the enzymes. That's inducing phase 1. If the issue is between phase 1 and phase 2, and it's not so much that you have the things in your body, but more that you're running through phase 1 so quickly, you're getting buildup between phase 1 and phase 2, like more of those toxic intermediaries, you're going to make your symptoms worse. So if you are pushing phase 1 without supporting phase 2, this is where a lot of mold patients start detox protocols and they absolutely blow out because you're inducing phase 1 while their phase 2 is really, really slow, or they have something going on with phase 3 that's not helping that remove that toxins through their bodies. So this is a really important granular thing to understand about detoxification, especially when detoxing people who have long-term exposure to mold. So in patients with mold toxicity, especially with patients who have that experience of going through a detox protocol and really reacting to it, sometimes we might even want to see if we can give herbs or other substances that are inhibitors of the CYP enzymes just to slow down that phase 1 detoxification pathway a little bit more so that phase 2 can catch up. So yeah, this is the part about phase 1 and what phase 1 has to do in terms of the role of detoxification, what can happen to it, and how do you make sure that your phase 2 is working fast enough that the intermediaries exist in your body for the smallest amount of time possible, because this is really going to make sure that detox happens in a way that makes you not react quite as much or blow up your symptoms quite as much. So part 2, I'm going to talk a little bit more about phase 2, how to support phase 2, and then I'll go into more details and more parts about each part of phase 2, because phase 2 is really complicated. Thanks. Hopefully this helps.